After tendon surgery, one question worries almost every patient. When can I start moving again safely? And the answer is more complicated than most people think. Move too early, and the repaired tendon could tear again. Wait too long, and the tendon may become trapped in scar tissue, leading to stiffness that can last permanently. That's why recovery after tendon surgery is a race against time, and timing matters more than pain. In today's video, we'll go through the real recovery roadmap after tendon surgery, explain why therapists sometimes move your joint before you are allowed to move it yourself, and show the warning signs that mean you may be pushing too hard. Whether it's a hand tendon, Achilles tendon, or patellar tendon repair, the healing process follows the same basic principles. When a tendon is surgically repaired, stitches reconnect the torn ends, but the tendon itself is still weak. In the first days after surgery, the repair can fail with excessive force or sudden movement. At the same time, keeping the tendon completely still is also dangerous because scar tissue starts forming quickly. This scar tissue can stick the tendon to surrounding structures, preventing smooth motion. Doctors call this adhesions. This is why rehabilitation must follow a very careful balance. Protect the repair, but don't allow the tendon to become stiff. This healing phase is often called the golden window of tendon rehabilitation. During this period, controlled movement helps healing, while uncontrolled movement can ruin the repair. One thing many patients find confusing is why physical therapists sometimes move the finger, ankle, or knee for the patient before allowing the patient to move it independently. The reason is simple. Passive movement and active movement are very different. Passive movement means the therapist moves the joint while the patient keeps the muscles relaxed. This creates very little stress on the repaired tendon. Active movement means the patient contracts the muscle directly, pulling on the repaired tendon with much greater force. For example, after hand tendon surgery, the therapist may gently bend and straighten the finger early in recovery, but the patient may not yet be allowed to actively grip or flex the finger. Passive movement helps prevent stiffness, improves circulation, and reduces scar adhesions without placing too much tension on the healing tendon. Now let's look at the typical recovery timeline. During the first few days after surgery, the tendon is extremely fragile. Pain, swelling, and stiffness are expected. The repaired area is usually protected with a splint, brace, or boot. The main goal at this stage is protection.
Around week 1 to 2, controlled therapy often begins. Depending on the tendon involved, passive motion or assisted exercises may start under supervision. This stage is risky because many patients start feeling better and assume the tendon is healed, but internally, the repair is still weak. In fact, one of the most common causes of rerupture is doing too much too soon. Between weeks 3 and 6, the tendon slowly gains strength. Active movement may begin, walking may increase, and therapy progresses carefully depending on the type of surgery. Around 6 weeks, many patients start light strengthening exercises. However, the tendon is still healing, and returning to sports or heavy activity too early can still cause re-injury. Now let's talk about red flags. Mild soreness during therapy is normal, but certain symptoms should never be ignored. These include sudden sharp pain, a popping sensation, rapid swelling, increased redness or warmth, sudden loss of movement, severe pain lasting long after exercises. For Achilles tendon repairs, losing push-off strength is concerning. For hand tendon surgery, suddenly losing finger movement may indicate a problem. A simple rule to remember is this: pain that gradually improves is usually acceptable. Pain that worsens after every therapy session is not. Recovery after tendon surgery is not about moving fast, it's about moving at the right time. Too much movement can rupture the repair. Too little movement can create stiffness and adhesions. That's why tendon rehabilitation always happens in stages. Protection first, controlled motion second, strengthening later. And most importantly, every patient heals differently. Always follow the rehabilitation plan provided by your surgeon and physical therapist, instead of comparing your recovery to someone else online. If you found this video helpful, don't forget to like, subscribe, and share it with someone recovering from tendon surgery.